In andrology, there is another subspecialty which is very common, that is in young people as well as in old people, that is infertility or male infertility. Male infertility is when the male is not able to conceive the female and he is not able to produce children or all that. That is very common nowadays. One of the main cause of infertility is because of varicocele or testicle vein. Multiple testicular veins will be present around the testis. So a patient will find testicular pain, he will find some enlargement of the testis near the bottom and pain, and while passing urine or while having intercourse he will have pain. So and the semen count they must have checked, which is very less. So these people would have tried for around 2 years or 3 years and still they would not have had a child. So when such patients come who does not have a child or desperately want a child, when they come, first thing we have to see is the hormone level of the patient, like testosterone, prolactin, FSH, LH. All these hormones has to be tested. If these hormones are less, that can cause to reduce semen count. And for as an investigation, next is we have to exact the amount, the semen count, the total semen count has to be tested at least 3 times to get the actual value. And out of that, how much semen is present with the motility, whether dead semen sperms are present or active sperms are present, all that has to be found out. Third is an ultrasound scan of the testis and the abdomen. An entity called varicocele, which I told, is something which causes more heat production around the testis. As a result, the sperm production from the testis is less. Naturally, our testis is out of the body, so that the heat production in the testis is less. That's why all of us are having sperms, which is around 120 million. So when this unwanted testicular veins are present, this will cause reduced sperm production and decrease in size of the testis. So once we confirm with ultrasound, if you have these testicular veins dilated, that is called grade 2 or 3 varicocele, we do a laparoscopic correction for this patient, which is called laparoscopic testicular vein ligation. It's a keyhole surgery. Keyhole surgery, we go in and ligate the 2 veins so that all these unwanted testicular veins are gone around the testis and the semen production comes back to normal level within 3 to 6 months. The treatment along with the surgery for these patients are 3 to 4 medicines, which we give for around 6 months to increase the semen count and the testosterone level of the patient. Then there are many psychological aspects also which causes this erection problem and other problems. And this varicocele is one of the common thing. Another problem is the tube which comes from the testis, which is called the vas deferens. The tube can get blocked and the semen will not come out. So we have to do a radiological procedure called vasogram, in which we put a dye into this tube and see if the tube is patent. This is the tube which brings the semen out of the testis into the penis. So if that is blocked, that also has to be surgically corrected so that the semen comes out freely. This is the major things which causes infertility. If nothing is working, and if the testicular hormones are the hormone testosterone or prolactin are very low and the testis itself is not functioning, then we can do the procedure called testicular extraction of sperm with a needle, or in the theater we go in, we open up a part of the testis and remove by hand, we remove few sperms which is present there, and we centrifuge it and assess it to see if we get good sperms, so that we can do in vitro fertilization or test tube baby or in vitro fertilization for this patient. These semen are cleaned, preserved, and they are implanted into the female egg, so that is outside the body. This is done only in patients when they have only 3 or 4 semens in the semen analysis. These are the few things which is there in infertility. Yeah.